According to a new article in The Guardian, the Netherlands is going to broaden euthanasia rules to cover children of all ages. Okay. These new regulations will apply to those age 1 to 12, okay, who suffer unbearably and have no hope of improvement. Let's take a look. The Netherlands is to widen its euthanasia regulations to include the possibility of doctors assisting in the death of terminally ill children aged between 1 and 12. Okay, so we are talking about euthanasia here, right? Again, remember the distinction. Physician-assisted suicide is when the patient takes their own life by swallowing a pill or something like that, whereas euthanasia is when the doctor directly kills the patient. All right, so the new rules would apply to between 5 and 10 children a year who suffer unbearably from their disease, have no hope of improvement, and for whom palliative care cannot bring relief, the government said on Friday. The end of life for this group is the only reasonable alternative to the child's unbearable and hopeless suffering, it said in a statement. The Netherlands became the first country in the world to legalize euthanasia under strict conditions in 2002. All cases must be reported to medical review boards. The law already provided possibilities for euthanasia involving terminally ill babies until their first birthday and for children over 12. Okay, interesting. Only one instance of euthanasia for a minor aged between 12 and 16 was reported in 2022. Figures from regional review boards show. Okay. The Netherlands will not be the first to allow doctors to assist in the death of children of all ages. Belgium has allowed it since 2014. Interesting. Okay. All right. So this news may be surprising to some of you because, first of all, euthanasia is not legal in the United States. It is illegal in the United States. Some states allow physician-assisted suicide, however. Okay. So this may sound pretty extreme. The second part is that it's allowing euthanasia for children, okay? And that might seem shocking because any medical ethics case that involves children becomes more controversial simply because children aren't their own decision makers, okay? So let's think about this. Like let's think about the ethics of this. Okay, let's kind of break this down. I think a good question to begin with is, what's the point of euthanasia, right? Like, why even allow it to begin with? What are the arguments? Okay. So I would say the point of it is to reduce suffering, right? That's the point. The idea is that there are some unfortunate people out there who have some sort of illness or condition that causes them unbearable suffering. And the longer that they live, the more suffering that they're going to endure, right? And suffering is obviously bad, or we think that it's bad, and we don't want these people to suffer, okay? And despite the best palliative care that we can offer, the world has to offer, for some people, it's just not going to work, right? So they're just really in a tough spot, and we don't want them to continue suffering. So that means the only way to end their suffering is to end their lives earlier. The other thing to point out is that children can suffer, right? I don't think anybody is going to deny that. So if you agree that suffering is bad, right, and that ending somebody's life can relieve their suffering, okay, and that children can suffer, then that is one argument in favor of allowing euthanasia for kids, right? That's one argument, okay? Now, as far as I can tell, a lot of proponents in favor of euthanasia will restrict euthanasia to people with a terminally ill condition. Who are terminally ill, okay? And that's a way to prevent people who are suffering from some sort of psychological disease from death, okay? Because the idea is that, well, psychological diseases are treatable, right? If you're suffering from depression, there's evidence that we can treat it. And so it's not the last resort for this person. Let's apply that to this scenario. We're talking about kids who are terminally ill, okay? There's nothing that we can do for them. We can't save them, and we can't treat their pain, right? So those are the main things to keep in mind when thinking about arguments in favor of euthanasia, okay, for kids. Now let's think about arguments against euthanasia for kids, okay? And let's talk about the kids, like not infants, right? Let's talk about like toddlers and like kids up to 12. One question is, what did the kids want, right? What do the kids want? Okay. Again, we're not talking about infants, right? We're talking about kids old enough to have an opinion, right? So what do the kids want? Do they want to die? Okay. We're assuming that these kids are suffering a lot, and maybe for the purpose of discussion, let's just say that they do want to die, right? Do want to die. Okay. So the question is whether or not the kids actually understand the gravity of that decision. Okay. Do they really understand? Okay. And that's generally the question when it comes to medical ethics cases involving kids, right? Because the assumption is that kids' brains haven't developed all the way. Okay. So they may express a preference for something like for a medical treatment or against a medical treatment, but we don't give them the authority generally to make medical decisions for themselves, right? Because of their underdeveloped brains. So the assumption is, okay, well, they don't really understand the gravity of the situation. They don't really understand the medical information that's being conveyed to them, okay? And so that's the worry here as well, okay? So let's say this terminally ill child, let's say this kid is like, 7, okay? And this kid expresses a wish to die. Like, do they actually understand, you know, what that means? Since the children aren't allowed to make medical decisions for themselves, it usually means that the parents are the surrogates, right? So the surrogate is the person who makes medical decisions on behalf of the patient when the patient cannot make decisions for themselves, all right? And generally, when it comes to kids, the parents are the surrogates. So in these cases, you have a surrogate asking a doctor to kill the surrogate's child. Okay, that's essentially what it is. The goal is to reduce the child's suffering, and the only way to do that is to kill the child, to euthanize the child. All right. So that adds another layer to it. Okay. So you are one step removed from the patient. Okay. So let's write this down. One step removed, right, from the patient. Whether or not the child is better off dead is a judgment that the parents are making, okay? And then the doctors would have to agree to, okay? But once somebody else is making that judgment, if it's not the person themselves making that judgment, a person with capacity making that judgment, then there's always another level of skepticism, okay? The other aspect is that the doctor has to kill the patient, right? Doctor has to kill the patient. The reason why this is important is because doctors generally don't want to kill their patients, right? They probably went to medical school to save lives and not to end lives. So you have a lot of doctors who would probably refuse to participate in something like this. And maybe you think that doctors shouldn't be allowed. You as a civilian, maybe you think that doctors should not be allowed to kill another person because generally we should just outlaw and prohibit one person killing another person. Okay, no matter what the circumstances. Maybe that's what you think. The other thing to keep in mind is an objection called the slippery slope argument. Slippery slope argument. Okay, so the slippery slope argument says that once you allow something like euthanasia for selective patients, what's going to eventually happen is that we're going to expand the practice, okay, and allow more and more patients to qualify, okay, and eventually we're going to end up in this situation where we really don't want to end up in, where we're going to allow something really immoral, like euthanizing kids, okay. A lot of people just they have a very strong aversion to this concept of euthanizing children, right? And people who are against euthanasia and against physician-assisted suicide will point to this news and say, see, I told you. I told you. Once we allow physician-assisted suicide or euthanasia in selective cases, eventually we're going to end up just killing kids. We're going to allow killing kids. And that is just unacceptable. All right, so I think I'm going to end it here. I hope you learned something interesting, and I'll see you next time.